Welcome to the lecture on lower extremity innervation. In addition to the cutaneous innervation of the lower extremity, you will need to know the lower extremity dermatomes and myotomes. You will find the dermatome maps for the lower extremity in Netter Edition 5 on plates 159 and 470, and in Netter Edition 6, plates 162 and 469. This slide lists the dermatome landmarks of the lower extremity. You will find consistencies across dermatome maps and consistencies across myotome maps in your handout section of your lab manual. Remember the definition of a dermatome to be the area of the skin innervated by a single spinal segment. This slide has a list of the myotomes of the lower extremity. Remember the definition of a myotome to be a group of muscles innervated by a single spinal segment. Now let's talk about the nerves that provide cutaneous innervation to the lower extremity. Note some of these nerves will also provide motor innervation to the muscles of the lower extremity. The first nerve we're going to discuss is the lateral femoral cutaneous nerve. We have already discussed this nerve when we talked about the lumbosacral plexus. This nerve is part of the lumbosacral plexus, is a posterior division nerve, and has contribution from L2 and L3. The lateral femoral cutaneous nerve does not have any voluntary motor innervation. It supplies cutaneous innervation to the lateral thigh. Postganglionic sympathetic nervous system axons to the sweat glands and the arterioles in this region will run in this nerve. We will discuss the sympathetic nervous system postganglionic pathways when we talk about the sympathetic nervous system. Pause the lecture to use this cutaneous innervation nerve map to draw in the innervation of the lateral femoral cutaneous nerve. How does your drawing compare? Note that on the left side of your slide is the anterior view of the lower extremity, whereas on the right side of the slide is the posterior view of the lower extremity. Be sure that you're labeling the area with the proper name. The femoral nerve is a part of the lumbosacral plexus, is a posterior division nerve with contribution from L2 through L4. This nerve has both voluntary motor innervation and cutaneous innervation. The motor innervation gives motor or voluntary motor function to iliacus, quadriceps femoris, sartorius, and part of pectineus. The cutaneous innervation goes to the anteromedial thigh. The femoral nerve also has a branch, a cutaneous branch, called the saphenous nerve. Pause the lecture to draw in the cutaneous innervation of the femoral nerve. How does your drawing compare? The saphenous nerve is a branch of the femoral nerve. It has no voluntary motor innervation. It does, however, provide cutaneous innervation to the medial lower leg and the medial border of the foot. Pause the lecture to draw in the saphenous nerve cutaneous innervation. How does your drawing compare? The obturator nerve is a nerve from the lumbosacral plexus, is an anterior division nerve with contribution from L1 through L4. The obturator nerve has voluntary motor and cutaneous innervation. The obturator nerve gives voluntary motor innervation to part of pectineus, adductor longus, adductor brevis, adductor magnus, the anterior head, gracilis, and the obturator externus. The obturator nerve provides cutaneous innervation to the medial distal thigh. Pause the lecture to draw in the cutaneous innervation of the obturator nerve. How does your drawing compare? The posterior femoral cutaneous nerve is a nerve from the lumbosacral plexus. It is a mixed division nerve and has contribution from S1 through S3. The posterior femoral cutaneous nerve does not have any motor innervation. It does have cutaneous innervation to the posterior thigh to just below the knee. Pause the lecture to draw in the cutaneous innervation of the posterior femoral cutaneous nerve. How does your drawing compare? The tibial nerve is an anterior division nerve of the lumbosacral plexus with contribution from L4 through S3. The tibial nerve has both voluntary motor and cutaneous innervation. The voluntary motor fibers innervate the following muscles: the posterior portion of the adductor magnus, semitendinosus, semimembranosus, the long head of biceps femoris, popliteus, gastrocnemius, soleus, plantaris, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. The tibial nerve provides cutaneous innervation to the heel of the foot. The tibial nerve also has three branches: the sural nerve, the medial plantar nerve, and the lateral plantar nerve. Pause the lecture to draw in the cutaneous innervation of the tibial nerve. How does your drawing compare? The sural nerve is a branch of the tibial nerve, but 2/3 of the time is formed by the union of branches from the tibial nerve and the common fibular nerve. Most often, the tibial nerve and the common fibular nerve join together in the distal leg, but this union may be as high as the popliteal fossa. 1/3 of the time, the sural nerve is a direct branch of the tibial nerve only. The sural nerve does not have motor innervation, but has cutaneous innervation to the posterior lateral leg and the lateral border of the foot. Note that the exact distribution of the cutaneous innervation to the posterior lateral aspect of the leg is dependent upon where the union occurs, if it is part of the tibial and common fibular nerve. Pause the lecture to draw in the cutaneous innervation of the sural nerve. How does your drawing compare? The medial plantar nerve is a branch of the tibial nerve and has both voluntary motor and cutaneous innervation. The voluntary motor innervation supplies motor to the muscles including abductor hallucis, flexor digitorum brevis, flexor hallucis brevis, and lumbrical to digit 2. The cutaneous innervation of the medial plantar nerve is the medial plantar foot, plantar surface of digits 1 through 3 and half of digit 4, the dorsal surface of the distal phalanx of digits 1 through 3 and half of digit 4. Pause the lecture to draw in the cutaneous innervation of the medial plantar nerve. How does your drawing compare? The lateral plantar nerve is a branch of the tibial nerve and has both voluntary motor and cutaneous innervation. The muscles that the lateral plantar nerve innervate are the adductor hallucis, lumbricals 3 that go to digits 3 through 5, plantar interossei, dorsal interossei, flexor digiti minimi, abductor digiti minimi, and quadratus plantae. The cutaneous innervation of the lateral plantar nerve is the lateral plantar foot, the plantar surface of digits 5 and half of digit 4, and the dorsal surface of the distal phalanx of digit 5 and half of digit 4. Pause the lecture to draw in the cutaneous innervation of the lateral plantar nerve. How does your drawing compare? The common fibular nerve is the posterior division nerve of the lumbosacral plexus with contribution from L4 through S2. The common fibular nerve has voluntary motor and cutaneous innervation. The common fibular nerve innervates the short head of biceps femoris. Its cutaneous innervation goes to the lateral knee and proximal lower leg. The common fibular nerve has branches to include the sural nerve, which is also with the tibial nerve as we discussed earlier, the superficial fibular nerve, and the deep fibular nerve. Pause the lecture to draw in the cutaneous innervation of the common fibular nerve. How does your drawing compare? The superficial fibular nerve is a branch of the common fibular nerve. It has both voluntary motor and cutaneous innervation. The superficial fibular nerve innervates the muscles of fibularis longus and fibularis brevis. Its cutaneous innervation includes the anterolateral aspect of the lower leg, the dorsum of the foot, and the dorsal surface of digits 1 through 5 to the interphalangeal and distal interphalangeal joints. It does not innervate the tips of the toes or the lateral aspect of digit 1 or the medial aspect of digit 2. Pause the lecture to draw in the cutaneous innervation of the superficial fibular nerve. How does your drawing compare? The deep fibular nerve is a branch of the common fibular nerve. It has both voluntary motor and cutaneous innervation. The deep fibular nerve innervates the muscles of tibialis anterior, extensor hallucis longus, extensor digitorum longus, extensor hallucis brevis, extensor digitorum brevis, and fibularis tertius. The cutaneous innervation of the deep fibular nerve is in a horseshoe-shaped area between digits 1 and 2. It encompasses the lateral aspect of the dorsal digit 1 to the interphalangeal joint and the medial aspect of the dorsal portion of digit 2 to the distal interphalangeal joint. Pause the lecture to draw in the cutaneous innervation of the deep fibular nerve. How does your drawing compare? Take this opportunity to pause the lecture to draw in the cutaneous innervation of the lower extremity. The nerves that provide the cutaneous innervation to the lower extremity include the lateral femoral cutaneous nerve, the femoral nerve, the saphenous nerve, the obturator nerve, the posterior femoral cutaneous nerve, the tibial nerve, sural nerve, medial plantar nerve, lateral plantar nerve, common fibular nerve, superficial fibular nerve, and the deep fibular nerve. How does your drawing compare?